Hello, my name is Alexis Darden, and this is my final project for INFM 635 with Dr. Vic Baskrin for Mercer University. So for part one of our project, we were to attach 3 UML models in the appendix for our scenario, narrate the message design process, provide a justification as to why we chose that particular HL7 version. The message implementation and the diagrams were supposed to be submitted as part of the appendix, and we were to provide screenshots of the challenges faced if we had any for our proposed scenario. So for part two, we were to contain an evaluation for any two health informatics standards that are used in a hospital information system or health information network. And before I continue, I'll show you my references. So for part two, I'll just show my models. So for my first and second diagram that can be found in the appendix, the name of my diagram is the patient is a suspected COVID-19 case. The actor in the scenario is the patient. The description of the scenario is to explain what happens in this particular situation. The successful completion of the scenario is that the patient goes to the clinician for COVID-19 symptoms. The clinician submits an investigation for the patient's symptoms to the public health unit for a diagnosis and test results. The alternative is that the patient goes to the clinician for symptoms, but the clinician does not send an investigation, but instead diagnoses the patient prior to the test results. The precondition is that the patient needs an appointment to be seen for testing. The postcondition is that the diagnosis of COVID-19 has been reported to the public health unit and also verified as the correct diagnosis for further treatment. So for my third diagram, the name of the diagram is patient goes to the doctor's office. It's the same scenario, but just with more added people to the scenario as far as the nurse is concerned. So I did not have any challenges when choosing my HL7 message, nor did I have any challenges when creating the message design process. It was simple to create the diagrams to showcase the knowledge I've gained when creating these diagrams. I chose HL7 version 2 for my final project because I like the way that the message describes the interaction between the patient and the provider. So here's my first diagram. You see that the doctor sends the investigation request to the local public health unit for the suspected COVID-19 case. The investigation request is received by the doctor, and the investigation request received by the doctor at the bottom of the diagram shows the order into the confirmation of the COVID-19 from the laboratory. So here's my second diagram, which shows the same scenario. And then my third diagram for the doctor's visit, which adds the nurse into the situation and also the head clinician for the diagnosis. So for our second part of the final project, we were to walk through the two standards that I chose were LOINC, and the other standard I chose was SNOMED CT. So for LOINC, while LOINC provides the codes that represent the names of information items, SNOMED CT provides the codes that represent ordinal and nominal values for those specific information items. LOINC is used for the laboratory test results, and SNOMED CT is used for EHR and clinical information capturing for various healthcare areas, with some to include computerized provider order entry, better known as CPOE, and cancer reporting. It's important to consider the benefits of both SNOMED and LOINC along with how useful they are in terms of interoperability and meaningful use. In a message reporting disease to the public health sector for reporting laboratory observations, LOINC would be used to code the posed question of what is needing to be measured, and SNOMED would be used to code the answer or the response. And that is the end of my presentation. Thank you.